Okay, hello and welcome to the Opioid Overdose Prevention Training. My name is Corinne Amezcua, and I am the Alcohol and Other Drug Prevention Coordinator and Suicide Prevention Coordinator for Nevada County Public Health. Our learning objectives for today are to learn the background and causes of opioid overdoses, how to identify the signs and symptoms of an opioid overdose, and learn how to use naloxone or Narcan and how to use fentanyl testing strips. We'll also learn about the opioid overdose prevention resources in our community. The training overview. We'll go over what opioids are and what fentanyl is. We'll go over the national, state, and local impact of opioid overdoses. We'll learn about the principles of harm reduction, and then we'll get into the Narcan or naloxone training, the fentanyl test strip training, and we'll give some resources and support in the community and time for questions at the end. Okay. How is Narcan relevant to me and who could overdose? The first one, people with an opioid prescription. That could be a family member or even ourselves, as we are prescribed opioids for a variety of different reasons. Could be major or minor surgeries, someone in chronic pain, or if we have an illness like cancer and need high pain management. We could be living with a family member who uses opioid medications, who may be often forgetful or forget that they've taken a dose and take another dose on top of that. Sometimes even opioid prescriptions are prescribed or given with Narcan by the doctor in case of an overdose. We may know people in the workplace or in school, or have friends in our group or in our community who may use drugs, or it could be people with a physical or emotional dependence on drugs, or people who use it recreationally and that are unaware of the presence of fentanyl. So having Narcan on hand is a great way to help save the life of not only the people we know and care about, but also the people in our community. Know Overdose Nevada County campaign came out a few months ago in collaboration with Nevada County Public Health and other community partners. The goals of the campaign are to educate and increase awareness among the community about harm reduction resources and supports. You can find information on Narcan and fentanyl testing strips, harm reduction resources, treatment resources and supports in our community, and you can even request a training on the website. You can head to knowoverdosenc.com or scan the QR code for more information. I'm going to pass it on to Shannon for the next part of our presentation.
Awesome. Thank you, Corinne. Hi, I'm Shannon Decker. I'm with an organization called the Speedy Foundation. We have contracted with Nevada County to provide overdose prevention and education in the Truckee-Tahoe region. And so I will be talking about opioids. What is an opioid? An opioid is a drug that interacts with the opioid receptors throughout our body and within our brains. An opioid is going to reduce the perception of pain that we experience, and it's going to increase the pleasure or the euphoria that we feel. Now, at a low dose, an opioid just makes us slower or sleepy, but at a high dose, an opioid is going to slow down our breathing and our heart rate to the point where if we're overdosing on an opioid, it will eliminate our ability to breathe, and thus our heart will stop beating. An opioid, there are different classes of drugs. So there's illicit drugs as well as licit forms of opioids. Street drugs are drugs like heroin. There are synthetic opioids like fentanyl. And opioids can be available by prescription in the healthcare setting. They're often given during hospital stays. Oxycodone is one that you might be familiar with. Opioids are kind of the term that we use, but there's another term called opiates. And so an opiate is derived from a poppy plant. Opium, morphine, heroin, and codeine are all opiates that come from that poppy plant. And opioids are those opiates in addition to those synthetic or semi-synthetic drugs like Vicodin, Percocet, oxycodone, and fentanyl. Some of the other common opioids that you might be familiar with are listed here on this slide. Things like Norco, Vicodin, Tramadol. These are common opioids that are prescribed as painkillers. And in the chart, you can also see what the generic name is. Like for oxycodone, a brand name would be Percocet or Percodan or OxyContin. So just to familiarize ourselves with some of the opioids that are out there. Opioids have been used for thousands of years, medicinally as well as recreationally and spiritually. Opioids came to the United States in 1775 and have been used, throughout our history in different capacities. The first United States epidemic of opioid use was during the Civil War. Again, we had another epidemic after the World War II, and starting in the late 90s and early 2000s is when our current epidemic of opioid use took off. Again, opioids are used in the medical setting as well as in the illicit drug setting. And today, what we're seeing happening is fentanyl really starting to become saturated in our illicit drug markets. So fentanyl is a synthetic opioid, which is about 100 times as potent as morphine. It is used medically to manage pain, especially after surgeries and with cancer treatment. But it's also used intentionally for recreational purposes because of how potent it is. If someone has built up a tolerance to another opiate, they might switch to fentanyl to get a stronger high. Most of the people who are using fentanyl are unaware of its presence because it's being mixed into street drugs and counterfeit pills. So the vials that we have pictured here represent how much heroin it would take for a person who does not have a tolerance built up for opium to potentially overdose. In the next vial is fentanyl, and you can see that it's just like grains of sand or salt. And carfentanil, it's just one little tiny grain. This next chart illustrates this at another level. We compare the potency against morphine being the standard. And so heroin is twice as strong as morphine, and fentanyl being 100 times as strong as morphine. So for a person who does not have a tolerance built up, a sesame seed, one sesame seed sized amount of fentanyl could put that person into a lethal overdose. Again, we're finding that fentanyl is being made into counterfeit pills. Pills like this oxycodone in the image here. The authentic oxycodone that came from a US pharmacy looks exactly like the fake oxycodone that was made in a drug distribution center. We're finding these counterfeit pills as Xanax, Percocet, Vicodin, Adderall. It's also in MDMA. It's being found in meth and cocaine, in heroin and ketamine, and essentially any other drug that you can think of. And it's very, very difficult to tell a counterfeit pill from a prescription pill that you would buy at the pharmacy. Now, there's a question that comes up often, and that is, can fentanyl be absorbed through the skin? So we're going to take a couple minutes to listen to this description from an ER doctor at UC Davis about some of the myths surrounding fentanyl.
Fentanyl is a synthetic opioid. Things like morphine and heroin are opiates that are made from the poppy plant, versus fentanyl is a synthetic made in a lab opioid that hits the opioid receptor. It's really potent, it's really strong. We use it in the hospital all the time. It's a really safe drug when used properly by doctors and nurses, but when it's really concentrated and people are using it at home, they can accidentally overdose very easily. It's a common myth that just by touching fentanyl, you can absorb it, but you really can't. And it's important that we emphasize and clarify that. It's so poorly absorbed through the skin that pharmaceutical companies actually spent millions and millions of dollars to develop something called a fentanyl patch. It's a very special way to deliver fentanyl in a patch that you wear. And even then, it's not very well absorbed. But definitely the powder or pills or anything that you find, not really absorbed through the skin. People who have an opioid toxicity, opioid overdose, that ingested some fentanyl or injected fentanyl, they have minutes, maybe just moments to live. So pausing, putting on whole body suit, PPE, or waiting for other people to arrive means that person might die. So we really need to intervene and help them as quickly as possible. That might be by doing CPR. It might mean by giving the antidote, which I carry with myself all the time, Narcan, Naloxone. So we have just moments to do that. And so waiting because we're concerned about skin exposure is not correct. Inhaling fentanyl can technically cause an overdose, but it doesn't get aerosolized very well. So fentanyl has something called a low vapor pressure. So you really can't aerosolize it without some very complex mechanism. You can play with it. You can technically throw it up in the air and have it fall, and you really won't breathe significant amounts in. So it's not really dangerous to walk in a building that has fentanyl in it. You don't need a fancy respirator or anything like that. So I told a friend of mine recently who's a paramedic about this because she was really worried about getting exposed to fentanyl. And the relief on her face when I clarified that it's not really something she needs to worry about, that she's not going to walk into a building and touch fentanyl or breathe it in and have something bad happen to her, it was such a relief. She told her family and they were relieved. So I think it's really important that we make sure everyone understands how this works. When someone overdoses on fentanyl or another opioid, their breathing will slow. They'll eventually become unconscious and their breathing may stop altogether. And that's how it's deadly. If you find someone who's overdosed on fentanyl or another opioid, you should call 911. And if you have Narcan, Naloxone, you should administer to them. The two most common ways it's administered are intranasally through the nose, and then also an injection. And in California, you can get Narcan, Naloxone. Anyone can get it without a prescription. Walking into a space, evaluating a person who's overdosed on fentanyl, calling 911, even doing CPR and definitely administering Narcan are all 100% safe to do.
So to sum that video up, what is the risk to an emergency responder? It's extremely low. This quote comes from a study that's been done by the American College of Medical Toxicology and the American Academy of Clinical Toxicology. And they say that fentanyl and its analogs are potent opioid receptor agonists, but the risk of clinically significant exposure to the emergency responder is extremely low. To date, we have not seen reports of emergency responders developing signs or symptoms consistent with opioid toxicity from incidental contact with opioids. Incidental dermal absorption is unlikely to cause opioid toxicity. So with that, I want to hand things over to Toby.
Great. Thank you so much, Shannon. My name is Toby Gavon. I'm a program manager for the Health and Wellness Division of Nevada County Public Health Department. And I'm going to be sharing a little bit about national, state, and local data as it relates to opioids, fentanyl, and overdoses. So the first slide, we look at the national impact. So on the chart, you can see in the dark blue line, the second highest line is synthetic opioids. And so you can just see the dramatic impact that synthetic opioids have had in terms of overdose deaths in the United States, really accounting for the majority of those opioid-related overdoses. In fact, opioid overdoses and fentanyl specifically are now the leading cause of death among US adults ages 18 to 45. Now, the CDC breaks it down in terms of accidental injuries as the large category. But if you break that down into drug overdoses and then break that down further into fentanyl overdoses, it is the leading cause of death among US adults ages 18 to 45. And so again, you can see by that chart just how much those overdose deaths are being driven primarily by synthetic opioids. So in terms of the state impact that we're seeing here in California, so in 2021, which is the last year that we have data, we had over 120,000 ER visits related to opioid overdoses, about 7,000 opioid-related overdose deaths, and that's out of 11,000 total overdose deaths. So about 60 to 65% of all overdose deaths involve opioids, and then 84% of opioid overdose deaths involved fentanyl. So you can see just through that data that really what's driving a lot of the opioid overdose deaths is fentanyl, accounting for between 8 to 9 out of every 10 opioid overdose deaths. Now, this is just another chart that highlights how much of an increase we've seen in fentanyl-related overdose deaths in the state of California. So again, drug overdoses are now the leading cause of death for Californians 15 to 44. And we saw the rates increase the most between the ages of 15 and 49. Since 2017, we've seen 11 times the number of fentanyl-related overdose deaths in California. And we've also seen an increase of 370% among teenagers. Now, this is lower than the overall increase that we've seen. So teenagers have been impacted less, but still a dramatic impact in terms of the overdose deaths and what people are experiencing in communities across the state. Now, when we look at the data, just specifically within Nevada County, and so this data that we're looking at right now, this includes people who have died of overdoses in Nevada County and also Nevada County residents who have died outside of the county. So in 2019, there were 18 accidental overdose deaths and 0 involved fentanyl. We first saw fentanyl enter the drug supply in March of 2020, and we saw an immediate impact. So 37 accidental overdose deaths total, with more than half of those involving fentanyl in 2020. Fentanyl overdose deaths have stayed relatively stable, 19 in 2020, 17 in 2021, and 17 in 2022. But you can see that overall accidental overdose deaths peaked in 2021 at 44 and then dropped down to 34 total. But again, essentially a doubling of the accidental overdose deaths that we're experiencing as a county as a result of fentanyl entering the drug supply. Now, here's just another way to look at this data in comparison to the state and the country. So Nevada County is that greenish turquoise line, and then the orange line is the US, and the dark brown line is California. So you can see that in Nevada County, we have a higher opioid overdose death rate per 100,000 residents than the US and the state. You can see that we are trending downward. So we actually, as we saw on that other slide, we had fewer opioid-related overdose deaths in 2021, and then we hopefully, in 2022, we saw the data in 2022, and we saw that dip as well. So that hasn't registered yet for the state. It takes a little while for that data to show up, but we're hoping that we're going to continue to see that going in the right trend. Still, far too many opioid-related overdose deaths, but some reason for hope that the efforts that are out there in the community, increasing access to Narcan, fentanyl test strips, other harm reduction efforts are having an impact here locally. And just to kind of highlight how much worse things could be if we didn't have access to Narcan and some of the other harm reduction tools. Since March of 2020, when fentanyl entered the drug supply, the High Intensity Drug Trafficking Agency has a data system called ODMAP that we have access to here in Nevada County. They report 166 non-fatal naloxone administrations. So naloxone is the opioid overdose reversal drug, 166 since March 2020. And that's just first responders. So that's emergency medical assistance like ambulance that's arriving on the scene of a suspected overdose. And then the Yuma Harm Reduction Collective, which is a fantastic harm reduction organization that we have here in Nevada County that's doing a ton of work on this issue. Their participants have reported another 73 overdose reversals. So when you combine those two numbers, you have more than 230 overdose reversals that we've had as a result of Narcan being available to people out in the community, which is really, really important. And this is actually likely an undercount of the Narcan administrations that have happened, of those overdose reversals, because when somebody is out there in the community who has Narcan, oftentimes there's no way for us to capture the information about an overdose that they may have reversed. And so again, it's good to see that we have Narcan widespread in the community and that it's being utilized. Things could be a lot worse, but again, we have a lot of work to do. And one of the things that we're going to talk about throughout this is really ways that people in the community can get engaged, can carry Narcan, can get trained to have a positive impact and potentially save some lives. We see on the right here, this is just an image that highlights the work of the Yuba Harm Reduction Collective in 2022. So you see those 54 overdose reversals that took place, the number of participants that they served, over nearly 2,200 Narcan doses that were distributed, which is fantastic, as well as about the same in terms of fentanyl test strips. So just a part of all of the work that's happening out there that we wanted to share with folks. And then we often get the question, why is fentanyl being put into street drugs? So it's very cheap to manufacture. So that's one of the reasons. It increases the overall euphoria and the potency of the drugs that somebody's utilizing. And then there's also sometimes accidental cross-contamination when drugs are being packaged near each other. And with that, I'm going to turn it over to Bethany, who is going to talk to you about harm reduction.
Thanks so much, Toby. My name is Bethany Wilkins. I am the director and co-founder of Yuba Harm Reduction Collective here in Nevada County. And I also am a contractor with Nevada County Public Health. So we're going to dive into harm reduction a little bit and talk about what that means and the approach that we take here at Public Health in response to our overdose crisis. So what is harm reduction? It pretty much lives in the name. It is reducing harms associated with things that people do on a regular basis or enjoy doing. It uses practical strategies, tools, and ideas, which we're going to cover in a few slides, to stay as safe as possible while using drugs. So really the foundation of harm reduction is just finding ways that we can stay safer when we're doing certain things. Some examples of harm reduction with these images on the side that you can see, condoms are a form of harm reduction because this reduces the likelihood of unplanned or unwanted pregnancy, as well as the transmission of STIs. Sunblock, which is great for protecting against sunburn and exposure to harmful UV rays. Seatbelts, again, these were developed when we realized that if we were in an automobile and we get into an accident, we need something to keep us a little bit safer. So we invented seatbelts. So these are all some examples of tools that we as humans and as a society have created to make us safer while we're doing things that we enjoy doing. So when we're talking about harm reduction in the terms of drug use, we're talking about things like safer techniques, safer ways of using drugs, managing our use, settings and supports, and being aware of those. We're also talking about abstinence or no use. And we're going to dive into each of these a little deeper. The principles of harm reduction are non-judgmental and non-stigmatizing. We honor people's autonomy. We take into fact socio-cultural factors that lead to drug use, and harm reduction is pragmatic and it's realistic. So the first thing we're going to talk about is safer techniques, or just ways that we can use drugs safer and less harmful ways. So safer techniques can look like testing your drugs using something like fentanyl testing strips, which we're going to get into a little bit later. Not using alone. When we're alone, we don't have someone there that can give us Narcan if we need it. Carrying Narcan, which you can see on the right here in this image, it is a nasal spray. It's also intramuscular, but the one that we're focusing on today is the nasal spray. Carrying Narcan so that you can provide emergency aid to someone that might be experiencing an opioid overdose or opioid toxicity. Not mixing drugs. So this goes across the gamut of all drug use, really. Not mixing, downers together. So that could look like not taking an opiate and also drinking, because those are both downers, and they combined increase the likelihood of respiratory depression to where your breathing is slowed, your body is so relaxed that you can stop breathing. So being mindful of not mixing drugs. A safer technique is how you're using. So we have the example here of smoking a drug versus injecting. This is less harmful to the body to smoke versus injecting. It's a little bit of a slower route of administration, but it is overall safer for the person that's using. Sterile syringe use is also a technique to stay safer. When people have access to sterile syringes or sterile use supplies, they are drastically decreasing the likelihood of transmission of bloodborne pathogens like HIV and hepatitis C. It's also decreasing the likelihood of forming abscesses from reusing a syringe multiple times. When someone uses a syringe for the first time, it bends the bevel of that syringe. The bevel is the point, and it bends it in just a micro way after that first use. And every time the person reuses that syringe, it bends the tip of that syringe that much more. So what happens with that is when someone is injecting using the same syringe with the bent bevel over and over again, it can create micro tears in veins, it can create tears in tissue, which then we're seeing lead to abscesses, which are infections. And abscesses can grow to be very, very dangerous and can lead to loss of limbs. So sterile syringe use is a way that we can avoid that. And then an example of a safer technique that we're all pretty familiar with is wearing a seatbelt. Back to that first example where we saw the condoms and the sunblock, a seatbelt is an example of a safer technique. So managed use, or I like to call this the scope of use for drug use. In harm reduction, what we want to do is support people no matter where they're at on this chart. And we have different tools and different ways that we can support them based on where they're at. So some of that can look like, starting slow, whether this is someone using drugs experimentally or, further on the right, habitually or daily. Both of those people could, start slower and see how the drug is feeling, especially in today's day and age where, unfortunately, fentanyl has found its way into most drugs, street drug supply. We want to start slow and see how our body reacts. Again, not mixing drugs. We talked about that a little bit ago. Using less. So this might not be an option for some people that are, on the far side of use, which is like habitual, daily, chaotic, or persistent. That can kind of look like a physical dependency. So sometimes people aren't able to use less, but if you're more on the left side of the scale of abstinence or social or experimental, using less is a tool to stay safer when you're using. And then a common example, again, is applying and reapplying sunblock. So that's a way that we can stay safe. Not only are we applying it once initially, we're also checking in and reapplying it as needed. So awareness of settings and supports, this is a super important one. And I feel like this is so applicable to so many situations beyond just drug use. This can be if you're going out with friends for a night or traveling to a new place. Having a plan for safety is really important. That can look like who has Narcan, where are we going exactly? What times are we going to be expected home if we're going out and we're living with someone that's, expecting us? So having a plan for safety and discussing those things is a way to stay safe and being aware of that. The buddy system and not using alone. So on the right here, you'll see Never Use Alone. It is an organization that provides over-the-phone support to people that are using drugs. They come up with an action plan with the user so that if they become unresponsive, Never Use Alone is able to call emergency services and get a plan in action. We often say that a safer way to use drugs is to not use alone, but it's not always a privilege that some people have, especially people that are highly stigmatized for their drug use or isolated or living outside without really access to community or a space to use in a safe way with someone that could help revitalize them with Narcan if need be, or call 911. So that's why we mention things like this hotline for people that might not have access to not using alone. Awareness of mental and physical health. Just keeping in mind, even if we're going out for a drink, if I just had a horrific day and maybe I lost my job, or, maybe I had a really stressful day at school, and I go out for a drink with some friends, I might have a much different time than if I had just got a promotion or just got a new car and was feeling on top of the world. So being aware of our mental state when we're using and our physical health, if we're fighting off sickness, avoiding drug use if possible, avoiding drinking if possible, so we can give our body a chance to heal. The environment where the use is taking place. Again, when we're talking about having a plan for safety in general, thinking about that environment, we live in a very rural area here in Nevada County. And so something we want to take in mind is, am I going to be using in a place that is accessible for emergency paramedics? Do people know where I am? Do I have cell phone service? These are kind of things to ask yourself. And a common example that we are all super familiar with is the designated driver or a Narcan carrier. But, usually if we're going to go out and partake in drinking or drug use, we have someone that we assign the DD as the designated driver to help get us home safe. So that's an example of harm reduction. That's an example of being aware of our settings and supports and using our community to stay safer. So abstinence. Abstinence is abstaining or entirely not using something or partaking in something. And so when we're talking about harm reduction, I think there's an idea sometimes that it doesn't include abstaining from drugs. And so we included this slide to really focus on the fact that abstinence or not using drugs is also a part of harm reduction. People can choose not to partake at all if that's what they desire to do. So there's some stats here too. Almost 45% of the US population aged 12 and older hadn't used alcohol or other drugs in the past 30 days. And the majority of high school students report not using alcohol or other drugs in the past year. So what this data kind of tells us is that, in the age of the fentanyl crisis and an increase in overdose deaths, we are seeing that there's still a large portion of our young people in that population that aren't using. So just to say, it's not, it's the addiction rates are maybe not as high as what we think they are, and the use rates are not as high. And the other percentage of people that are using that are young, it's tools like Narcan and knowing how to administer it and having a buddy system. These are the tools that we can use to keep them alive if they are going to be in those environments or using drugs themselves. So the harm reduction approach, in the first slide, I talked a little bit about it being non-judgmental, non-stigmatizing, and non-coercive. We're going to dive into that a little bit more. Not judging people for their drug use is really paramount in maintaining connection. And we're going to dive into those specifics. Non-coercive, that just means we aren't coercing someone towards what we think is best for them, towards treatment or towards a certain way of using. We're really meeting them where they're at, exactly where they're at, whether that is IV drug use, whether that is habitual daily smoking, whether that is ritual binge drinking. We are meeting them wherever they are on that continuum of use, and we're not coercing them to the left or to the right. So when we're talking about stigma associated with drug use, we wanted to share some strategies to reduce stigma that are pretty realistic for us in our day-to-day. Offering compassionate support and kindness to people in vulnerable situations. This is pretty basic, right? Something that I do want to name is that if you are very close or not even very close, if you're peripherally close with someone that might be on the right side of that drug use scale, and is maybe a physically dependent drug user or a chaotic drug user, as they say, it might be harder to manifest compassion and kindness because with chaotic drug use often ripples out chaos from that person's life. And we're often affected by it if we're close to them. So just to say, things like being kind and compassionate to people who use drugs can sometimes be easier said than done. But I really believe that if we can muster it up as much as possible and take a deep breath and try to offer that kindness to them, that's where we start to see the shift that we're going to talk about here. So seeing people for who they are and not the drugs that they use. People use drugs for an entire variety of reasons. Someone might be self-medicating. They might be processing trauma. They might be using drugs to stay safe if they're living outside. They might be using amphetamines to stay awake so that they're able to protect their belongings while living outside. Those are more kind of extreme examples, but people also just like to feel good. And sometimes they want to use drugs. Sometimes they want to drink, so we aren't judging people or seeing them for what drug they're using or why they're using it or looking at them and the entirety of their entire being as just their drug use. People are so much more multifaceted than the things that we're choosing to do. So our aim is to see them for who they are and not the drugs that they're using. So treating people with dignity and respect, this kind of goes into the kindness and compassion. I think it's, as someone that's been in recovery for almost a decade now, in various forms of recovery, from opioids and stimulants and alcohol, it goes so far just to have people treat you like you're a human being. And that ties into avoiding hurtful labels like addict or junkie. Those things are super stigmatizing and really dehumanizing, doesn't make you really feel human or like you belong. And when we remove that feeling of belonging and humanity from people, it can really send people into shame spirals. I know it sent me into feelings of shame and isolation. And then I was just even more, focusing on the fact that this is the way people saw me, so I might as well keep using, or I would use alone because I was ashamed. So when we avoid calling people these things, and we can show a little bit more dignity and respect to drug users, the idea there is that they aren't isolated, they aren't sitting there and shame spiraling. We're treating them like they're humans and showing them that they matter, even if they are using drugs. And so when we dismantle stigma, when we do all of these things, or some of them, or try to, what we see is that fear and shame that I just spoke of, that I felt so deeply as a drug user. It really dismantles that and the burdens associated with it. It can increase confidence, it can improve trust, increase the likelihood that someone will reach out for help. If someone is using and wants to change how they're using, maybe that's moving to the left on that continuum of use, whether that looks like switching from injecting to smoking, whether that looks like taking your use down to every other day, whatever that change is. People that use drugs are definitely more likely to reach out to someone that has not been berating them with hurtful and dehumanizing language, someone that has seen them for who they are as people, and that they know won't judge them. And so I do street-based outreach for the past 3 years in this community, and I have seen firsthand how amazing it is to employ these strategies to reduce stigma into our service model. And we see the trust build, and we see confidence build, and we have participants that come to us when they are ready to make a change because they trust us and because we haven't been providing them stigmatized treatment. So just to say, if we can try to do these things here on the left, these strategies, I guarantee we're going to see the result is this list on the right. So participant autonomy, what this basically means is we trust that people are the best representations of themselves, that we honor their decisions, we honor their values, what they're doing with their life. People who use drugs are experts in their own lives, and they are the primary agents of change. And so what we want to do is, if they do want to change, we want to empower them to do that themselves. We seek to empower people to share information and support each other in strategies that meet their conditions of harm. It meets people where they're at, but like I was saying earlier, it doesn't leave them there. We're going to meet them wherever they are on that scale, and we're going to be right there with them, whether they want to stay right where they are, or they want to move to the left or the right. We are meeting them there, and we're not leaving them. So sociocultural factors, this is a giant topic that we could talk about for hours, but we're going to condense it into a quick slide. This recognizes that social inequalities affect people's vulnerability to and capacity for dealing with potential harm. So this can look like, we live in a very rural area. This can look like not having access to resources and support because you live very far out and you're not able to get into town for things like treatment, for things like peer support or counseling. Discrimination is a major factor in drug use, maybe why people do use, and then also why it's even harder to cease use or to, change how they're using is how they are treated based on discrimination. And then environmental factors is another part of this. Environmental factors impact the harm people experience. There are a lot of people that have been displaced due to wildfires in our area. And so that is a factor that comes into play with people that have, been unhoused and lost the things that they own and not been able to get back up on their feet easily. That is predominant in areas where there is, massive wildfires. So taking all of these into mind when we are working with or serving people who use drugs or they are in our life, recognizing these factors that are much bigger than themselves and bigger than them as an individual that are affecting their drug use and how they're able to change their drug use. So pragmatism and realism, harm reduction is realistic. Instead of taking an approach of telling people that they should never do drugs, and if they do drugs, they're bad, and it's going to lead to X, Y, and Z, we try to understand that realistically, people are probably going to use drugs sometime in their life, whether that's just drinking or, that's cocaine or, any of those things. And so we're going to accept that people are going to use drugs, and we are realistically going to offer support for their drug use. We don't want to ignore or minimize also the real and tragic harms and dangers that are associated with drug use. And that's really important here, where, within harm reduction, I think we can kind of think sometimes that we're just saying drugs are fine, drugs are great, it's okay if everyone does drugs forever. And the reality is they can be very harmful to our bodies. They can, deteriorate our bodies. They can be harmful to our mental health. There's a lot of negative health outcomes and negative, general life outcomes associated with certain drug use. So we want to name that, and we are not attempting to ignore or minimize that reality. But what we are trying to do is focus on ways that we can keep people alive while they are still using. Again, going back to that realistic aspect, we're acknowledging that there is risk, and we're going to do everything we can to keep people safe while they are choosing to use. All right, so that is it on harm reduction, and I am going to pass it over now to Ree, and she's going to discuss overdose awareness.
Thank you so much, Bethany. My name is Jen Winders, and I am a social worker and contractor with Nevada County Public Health, and also one of the founding members of the local Yuba Harm Reduction Collective. So we're going to talk about overdose awareness now. We'll start out by looking at some of the risk factors for overdose. So we're looking at these from two perspectives. One is risk factors that are drug related, and one is risk factors that are situation related. So one of the drug related risk factors are using multiple drugs. So drugs, when they're taken together, can interact in ways that increase the overall effect. And when drugs are combined, that risk of overdose is substantially increased, especially if they are two sedatives. So for example, if you're mixing an opioid with alcohol or a benzodiazepine, and that's something like Klonopin, Valium, Xanax, for example. So if you're combining two sedating drugs, that does increase the risk for overdose. We're also looking at purity and potency as a risk factor for overdose. So the content and purity of a drug can be unpredictable when it's a street drug. Often they are cut with other drugs or materials that can be dangerous, and so that can add to potency. So you don't really know how pure something is by looking at it, or even at this point by knowing what you've had in the past, because again, things are so unpredictable and changing. Okay, so then we're looking at tolerance level. So tolerance is our body's ability to process a certain amount of a drug. That can waver a bit depending on somebody's size or their illness or their stress levels, maybe a compromised immune system, even age can affect tolerance. The really important thing about tolerance is that it can decrease rapidly if someone's taken a break from using a drug, whether intentionally or not. So perhaps somebody's in a treatment facility, for example, or in drug treatment, their tolerance can go down quite a bit. If someone is in juvenile hall or jail or in the hospital and then they come out, the amount that they can take then is going to be different than the amount they were able to take before. So tolerance decreases, and if someone does take the same amount of a drug, that is a risk factor for overdose. Another risk factor is having a new supply or a new product. And so, this one is, again, because of the unpredictable nature of drugs on the street right now. And also, as we spoke about earlier, fentanyl could be cut into something. And so that's really an example of seeing a change in product across the board. And then a change in method of use is a risk factor for overdose. So there are ways of using drugs that deliver the drug more quickly to the brain and are more likely to create a risk for overdose. For example, intravenous injection has a higher risk for overdose than perhaps snorting a product. And if somebody's used to doing something like snorting and then they switch to smoking or injecting, they're going to increase their risk for overdose. So some other risk factors are situation related, and I think we mentioned coming out of treatment or being released from juvenile hall or jail already. Tolerance is changing. Using alone is a big one. So using alone is a message we've looked at in our harm reduction section prior to this quite a bit. And it can be kind of challenging because we encourage people to not use alone. And on the other hand, we also know that often people are. So we really want to make sure our messaging is around not just not using alone, but also what do you do if you are using alone to reduce that risk of overdose? So helping people think about their vulnerabilities, identifying trusted folks to be there who know how to respond to an overdose, or identifying someone they can call ahead of time, having a plan in place are really helpful when we talk about this risk factor. We might even say something like, rather than just don't use alone, encouraging that someone doesn't try something new alone, or changing their dose. Don't change your dose alone. So there's some ways that we can really support folks in this risk factor and shifting it. We also think about physical health when we're looking at risk factors. So if somebody has a compromised immune system, or if you've been sick recently, or you have a current infection, for example, or you haven't been eating or sleeping well, those all put someone at more of a risk for overdose. And then mental health and mindset is also critical when we're talking about risk factors and supporting people in using drugs safely as well. So if you are thinking about using drugs, really kind of gauging where you're at, right? Asking yourself where you're at emotionally. Is there a lot of stress going on for you in that moment? And then kind of using that information to shape how somebody might be using. So thinking about how much consumption can support their emotional need without overloading them. And maybe using slow or not rushing, just like we mentioned before in our harm reduction techniques. Physical environment is another big factor. So if somebody's not feeling safe, somebody's in more challenging weather situations, or they're unhoused, there's a lot of pieces that can increase the risk for overdose. And those are all intertwined with physical health and mental health as well. And then the biggest one that we have at the bottom, because really I think it's the one that affects everything else, is stigma. So stigma is so related to whether or not someone can reach out around not using alone, whether they feel safe to do so, whether they can talk to somebody about their drugs or their methods of use. So really combating stigma is a huge piece of kind of overcoming some of these other risk factors as well. Okay. So if we're wondering if something is an overdose, this is great information to have to kind of take our role on as a first responder in the community with friends and loved ones. So there are some signs that somebody is using opioids. And these can include things like relaxed muscles, kind of having a slower movement or slower reactions. Our speech might be slurred or slow, and we might have pinpoint pupils. So those are all signs of just using opioids, not necessarily signs of an overdose. When we think of signs of a potential overdose, the biggest one really we're going to see is that somebody is unresponsive. So we're going to actually look a little more deeply into all of these signs of an overdose in just a moment. So slow, irregular, or no breathing, clammy skin, gray or blue fingernails or lips, and slow or irregular heartbeat or low blood pressure. So these are all signs of a potential overdose. So getting into a few of these with a little more detail. Pinpoint pupils, you'll see an example of that there on the left in that photo. So that is just a sign of general opioid use. This does not mean that somebody is necessarily experiencing an opioid-related overdose. But if that's combined with the other overdose signs, for example, the big one, someone is not responsive, then it gives us a hint or a clue as to what might be going on for them. And of course, we always want to just factor in that the light conditions might change somebody's pupils as well. So here's our main sign. Somebody is unresponsive to sound or touch. So our verbal or physical stimulus does not rouse them. So in our traditional first aid response trainings, we often hear that phrase, "Hey friend, are you okay?" This is across the board going to look the same, especially since we don't necessarily know if it's an overdose or not. So we might shake their shoulder, we might tap the bottom of their feet if that's available to you, and then we might also use a sternum rub. So a sternum rub is basically making a fist, and you're vigorously rubbing their sternum. And you know, we don't want to necessarily bruise them, but at the point of maybe doing it for maybe up to 30 seconds is what they say medically. So those are the ways that we're going to see if we can get someone to respond. So the second and also most common sign here is that somebody's breathing is slow, irregular, or stopped. So they might have irregular or shallow breathing. They might have deep snoring or gurgling, and that can mean that their airway is obstructed because they're having trouble breathing. They might not be breathing at all. So knowing our rescue breath techniques are a really important tool here. And then we know that why this is so critical is that most opioid overdose deaths are caused by that lack of oxygen getting to the brain, right? So really critical sign to look for. We also might see a change in their skin, their lips, or their fingertips. So someone's skin might be cold, pale, or clammy. Their lips and fingertips might have kind of a bluish purple or gray ashen tone, really depends on their skin tone, so you might see any of those. And this is because of something called cyanosis, which means that there's a lack of oxygen going to the red blood cells, and therefore it's not going into the extremities. So we're going to kind of just briefly touch on what happens during an opioid overdose. And before I get into that, I just want to name that all of those signs are really important to know about just for all of us as community responders, but they often don't really matter in that critical situation. So if you come across someone who is unresponsive, we don't want you playing detective or trying to figure out what drug they took or looking around for signs of opioids. Because number one, they may have taken something that they don't know has an opioid in it. For example, the example of fentanyl being in something. And also because using naloxone, Narcan, is not going to harm them if they're not having an opioid related overdose. It is just a critical step in first aid at this point. So you can go ahead and give that Narcan right away, like it says there on the bottom, and not play detective and try to figure out what's going on medically. So when that overdose is happening, a toxic amount of an opioid alone or combined with other drugs floods the opioid receptors, and the organs don't receive enough oxygen, so they begin to shut down. So this can lead to unconsciousness, brain injury, or possible death. And brain injury can actually begin within 3 to 5 minutes. So this makes it really critical for us to intervene. So once again, not pausing or hesitating, just getting right in there to give naloxone, Narcan right away. Okay, and I'm going to hand it over to Shannon now to give you your Narcan naloxone training.
All right, thank you, Jen. Let's dig in. What exactly is naloxone or Narcan? These are images of what naloxone or Narcan might look like. Here with me, I also have a box of Narcan. This is the form that you will see most often throughout Nevada County, but it does come in several formats.
I couldn't see it, Shannon, the box that you held up.
You couldn't?
No. Barely.
Really?
Yeah.
Okay, well, I've also lost control of the screen. I don't know why. Maybe, because somebody put a chat in.
Oh, is that, sorry, I was telling you to lift it up because you could just see the top of it. Maybe put it on your shoulder or something like that.
Okay. I don't have I only see you guys. Give me just 1 second.
Okay.
I don't like that view either.
I can hold one up too if that helps. But
I don't know whose picture it'll be.
Can you do the gallery view, I think is what it is, or like
side-by-side gallery view? Okay.
Yeah, there's like the two things on top of each other at the top of it.
yeah, it looks good, Shannon.
Yeah,
Okay,
there you
that's
go.
better?
Yeah, that's great.
Okay.
Yeah.
All right. Okay. Now let me try to get control again. Okay. All right, we're going to start over. Thanks, Jen. All right, we're going to talk about naloxone or Narcan. These are the drugs that are the antidote to opioids. So naloxone is the name of the drug, while Narcan is the brand. And Narcan is the version that we have most often available throughout Nevada County. It comes in a box with 2 of those nasal sprays. Narcan, or naloxone, is an opioid antagonist. Again, there is an injectable version. There is one where you can twist on a nose cap. There's one that's kind of like an EpiPen that you can inject into the leg. But the one that we have available, the one that we have at our partner organizations available at no cost to community members, is Narcan nasal spray. When we administer Narcan, it's going to rapidly reverse an opioid overdose, but it might take more than 1 dose, and that's why a kit comes with 2 doses in it. Narcan is legal to have and to carry at any age. It is not a controlled substance. It will not get you high. It is safe to use on someone even if they're not overdosing. So as Jen was sharing information about signs of an overdose, she said, don't be the detective. If you don't have a medical degree, there's no expectation that you would be able to determine if this is an overdose or not. Narcan is not going to have negative side effects. The only thing that might happen is if a person has an allergy to Narcan. But again, we can give it to children, to aged individuals. We can give it to pregnant women. We can give it to animals if animals happen to have been overdosing. In California, there is a statewide standing order that allows individuals and institutions to have Narcan at any age. So the way that Narcan works is that it's going to attach to the opioid receptor in the brain and block the effects of the opioid for about 30 to 90 minutes. So we've got an image here of the opioid receptors that have the opioid resting on it. Naloxone or Narcan comes in, it wipes it out, and it'll protect that receptor for a short period of time. After that time, someone might slip back into overdose. And so that's why we don't want to just administer Narcan and let it go. We need to stay with them, and we need to get them medical attention. And so when administering Narcan, the first thing you need to do is determine that the potential of overdose is happening. And then we want to follow some steps. First, if you're with someone else, have one person call 911 and the other person can begin to administer the Narcan. If you're alone, go ahead and administer the Narcan first before calling 911. And as Jen said, you're going to be, shaking the person to say, hey friend. So go ahead and tell them, hey friend, I'm going to administer Narcan. In this situation, our biggest concern is the lack of oxygen to the brain. So time really is of the essence here. Reminder that when you call 911, if you call and you're not in cell service, typically your cell phone still works, and you can always put them on speakerphone so that you can be working as a first responder and communicating with dispatch. So what you'll do is you'll go ahead and open your Narcan box, and inside you'll have a packet that looks like this. You're going to want to tear back the foil from the packet like this. Try to keep Narcan available. You can take it out of the box and put it directly into a first aid kit if you have one, or into any type of supply that you keep with you. This is what the Narcan will look like. It will come with some instructions that you can unfold and read, but in an emergency, we don't have time for that. And so we'll look at what these instructions are. What we're going to do is we're going to take the person and lay them on their back if possible. We'll tilt their head back if possible, and we can also support their neck by putting your hand on the back of their head if possible. If you have additional training as a first responder, you might have more information as to how to move someone in case there's a risk of a neck or a back injury. But if possible, let's try to get them laid out flat. So to give the Narcan, what you want to do is you want to put your thumb on the plunger, you want to put your fingers on the device, and then you'll insert the tip into the person's nostril, and you can plug the other nostril, put the finger against it, and then you're going to push fully on the plunger to deploy the full 4 milligrams. If you try to test it out and just push a little bit, it could waste some or all of the dose, and we don't need to prime this at all. So again, we're going to put our thumb there, and then we're going to deploy it into one nostril by pushing firmly like this. So after you've given that first dose, if they're not breathing regularly, go ahead and start giving rescue breaths. We've got them down flat. You can pinch their nose and breathe into their mouth. It's about 1 breath every 5 seconds for 2 to 3 minutes. And hopefully you've either got someone there with you or you have dispatch on speakerphone so that 911 will be responding to your location and you can be speaking with the operator. If you are giving rescue breaths for 2 to 3 minutes and they have not become responsive and are breathing on their own, then it's time to take out that second dose from your Narcan box and give it in the alternate nostril. And you can repeat this as necessary until the overdose is reversed or until emergency services arrive. When we've trained first responders that have administered Narcan, they have said that when there's a higher potency in someone's system, that it can take more than just the 2 doses of Narcan in a kit. And so that is a possibility. Again, in between doses, if you haven't already called 911, go ahead and do that. We need to get a first responder to you as quickly as possible. If the person does begin breathing on their own, you can place them in the recovery position, which is shown here in this image. It's a person who is tilted over to their side. They have one arm out and one arm tucked under their head. This will help so that if there is a drug or alcohol overdose situation and they become unconscious, this is one way where they're positioned so that if they do start to vomit, that they don't aspirate on it. And you take one of the legs and just kind of put it out so that it's like a kickstand. Now, when someone comes to from a Narcan administration, they are in withdrawal. So when they wake up, they could be really confused. They could be scared or angry. They could be really upset and shaking. They could be nervous, or they could be physically sick. Police and paramedic presence could be really frightening for a person. And so that might be alarming to their system. You can use, your presence and your support to just help keep them calm. You being there as a first responder is a really important role. You can use phrases like "help is on the way," "I'm here for you," "you're safe," to reassure this person. It's also possible that they could become a little bit violent. They could start to go out. And so you need to keep yourself safe in that situation. Make sure that you can step back and just protect yourself or anyone else that is in that space. When it comes to getting in trouble with the law, we do have laws to protect us. Most states in the country now have Good Samaritan laws in place, and California definitely has Good Samaritan law. So if you're going to call 911 for an overdose-related incident, not necessarily just for opioids, and there's only personal amounts of the drug or drug paraphernalia around, like we're not trafficking drugs, we're not distributing drugs, then you can't be charged. The law was created so that people feel safer calling 911 in a crisis. So the definition for possesses for personal use may vary. And people that are on the scene cannot obstruct the medical or law enforcement personnel as they are making efforts to deliver the medical help. We also need to remember that no other laws can be broken, and the person can't be on parole. So, for example, in talking with law enforcement, some of those considerations might be, if somebody has a firearm that they don't legally have access to, or perhaps like child endangerment. If any of that is taking place, the Good Samaritan law doesn't apply. But for most of us, this law is what protects us from any type of legal action if we're responding to an overdose or a mental health crisis and the person doesn't make it. We're protected because we are doing our best efforts. As well as if we were engaging in drug use and someone overdoses, we're not going to be prosecuted for the drug use that we had in trying to get them care. It is not a crime in California to report an overdose under the Good Samaritan law. Please don't be afraid to call 911. And I'm going to put out this call to action at home, in your office, in your car, at your sports teams, at your local organizations and local businesses. Let's make sure that we add Narcan to our first aid kit. We do want to keep in mind that we don't want Narcan to freeze or be exposed to excessive heat. So take that car example on a case-by-case basis. But have Narcan on you and know where you can obtain it when you need it. And so with that, I'm going to turn it back over to Jen.
Thank you so much, Shannon. So Narcan is one of our tools that we have in our harm reduction toolbox, and fentanyl test strips are another. So we'll talk a little bit about what those are now. So fentanyl test strips are available to test a drug product for the presence of fentanyl. These were at one point a urinalysis test used primarily in treatment settings or for probation to test urine for the presence of fentanyl. And then at some point, harm reductionists realized that this is something that could be used to actually test the drug supply itself. So they are available to use on anything made liquid. And one thing about them is they do require very specific measurements, and that can vary depending on the drug tested. So you'll see here a little bit more detail. They usually come in these individual packs, one in each pack, and we'll talk about some resources for these at the end of our training. So to utilize these, you would actually dissolve a small amount of the drug supply in water and dip the test strip into the liquid for about 15 seconds. So these test strips are highly sensitive, and a minimal amount of drug is sufficient to obtain a result. And on the instructions, if you are to obtain these test strips, you'll see the real details around measurements. So those test strips get dipped in there. Similar to if you were using a COVID test or a pregnancy test, right? So you're putting it in the liquid, taking it out, setting it on a flat surface until results appear. And that's typically within 5 minutes. But again, you'd want to check the instructions for the specific test strips you're using. It tests for the presence of fentanyl, not for how much is in the product of fentanyl. So it's not going to tell you if there's a lot of fentanyl or a little bit. It's just going to tell you if it's detected. So we're going to use these with caution. And why we say that is you'll see on the top, one line is positive and 2 lines is negative. If there is fentanyl in something, sorry, let me back up there because I'm forgetting. Sorry, Toby. What's the next slide? Is that the chip one? Yeah, okay. Okay, go back. Thank you. All right. Okay. Let's see. Okay. So the way these work is actually the opposite of a COVID test or a pregnancy test. So you're going to see on there, 1 line is positive for fentanyl and 2 lines is telling us that there's no fentanyl in the amount that we've tested. And we say use caution there, and that's because of something called the chocolate chip effect. So the chocolate chip effect essentially means that if you have a product, a drug, whether it's a powder or a pill or a liquid, fentanyl can be cut unevenly in that product. So there may be chunks of fentanyl in a pill, for example, just like there's chocolate chips throughout a cookie. They are unevenly distributed. And what that means is that if you were to test part of a product, you're only going to know if there's fentanyl in that part of a product. So we've had situations where we've had somebody split a pill. One person got half, the other person took the other half. One person overdosed and the other person did not. And that's because fentanyl was distributed unevenly in that pill. So same goes for any other powder or liquid product. So we say here is that even if you're going to use fentanyl test strips as a harm reduction tool, we just want to make sure you know to always have Narcan on hand as well. And you'll see a close-up here of a test strip. So you'll see how they're used, and again, similar to a pregnancy or COVID test, but the results are the opposite. So you'll see there that one red line a little bit closer, a little easier to see it, and the two red lines meaning it's negative for fentanyl just in that amount that you've tested. And then you'll also see on the right side the little wavy lines. That's the part you're inserting into liquid. So again, a great harm reduction tool. And also it's not without the challenges, meaning that we want to make sure that people have Narcan on hand no matter what. So I'll hand it over now to Devin to talk a little bit more about some resources.
Thanks, Jen. Nice job. I'm Devin Bradley with Nevada County Public Health, Health and Human Services in Eastern County, up in Truckee, and Health Education Coordinator. So I want to go over just a couple supports and resources that are available in our community. So yeah, big key component here of harm reduction strategies is to really provide as much non-judgmental support you can to people who are using, thinking about using, who want to quit. So a good question you can ask them or friends, whoever you're supporting, even if for yourself. Do you have an overdose plan? Like if something goes wrong, what are you going to do? Who can call? Who can have support? Is there Narcan present? Do we know how to use it? Where is it? That's a really good strategy to adopt. So yeah, and just making sure those who are using know about it, your friends. Another thing is your safety. That's the most important piece. So someone who's using, can I help you? Is this important? Is this helpful? And then just telling people, if you do need to use again, please don't do it alone. There's other supports. You can call me. I won't be, judgmental. I want to help you and support you. So it's really important to give reassurances, information, and resources to people who are using. Giving advice might not change someone's drug use patterns. It's pretty predictable. It's really hard to kind of curb it. And some people might not even want to curb it. They might not even want to quit. That might not be their goal. It's really difficult to stop using for some people. It might take more than one attempt. Similar to alcohol, it takes many attempts to break that cycle or to develop new patterns. So just be aware of that. Willpower and self-resolve are not always going to be enough to solve this problem. Resources that we covered in the beginning, definitely worth covering again here. This Know Overdose NC.com is a campaign we've put together with some support of lots of community members. If you're interested in joining, you can sign on as a campaign sponsor with your organization, which is great. We have a lot of great community organizations supporting this. If you go to that link tree there, you can get all the information anyone would want, where to get Narcan, fentanyl test strips, other support resources, even some information about treatment as well. So please go on there. We're really happy you've joined us for this presentation. Ways you can help, spread the word with families and friends. Social media is great. We're going to be posting a lot of social, which we have. Connect with other people, groups, organizations, church groups, anyone you're involved with work. And then people can become distributors as well. So if your organization is really passionate or has the capacity, you too can become a distributor. You can provide this Narcan to your constituents. And we've got a couple questions here, but once again, we really want to thank you. for joining us on this presentation. We're really happy to put this together in video. I'll share a couple quick contact details after we go through these questions on how to get a hold of us as well. So looking here in the chat, it looks like I have a question here. What ages have been impacted by the opioid overdose deaths locally? So I'm going to put that out to the team here. If anyone wants to take that on, Toby.
I can tackle that one, Devin,
Sure.
since I covered the data piece. So really we see the opioid overdose deaths impacting people across age ranges. It really isn't younger folks or older folks or folks in the middle. It really is impacting people across demographics. And I think that's one thing to be really mindful of. We may have an idea in our minds about who may be more or less likely to be experiencing an overdose. And like folks have mentioned a bunch of different times, like your role as a community member and as support is not to play detective in that situation or to kind of think about whether somebody might be likely to be experiencing an overdose, but go by that sign, the lack of responsiveness. There's no harm in administering Narcan, so responding in that situation. So to answer the question specifically, we really see it happening across demographics in Nevada County, and that's true also across the state and the country, really.
Thanks, Toby. That's helpful. One other question coming in here. Are you ever concerned that the harm reduction approach is encouraging people to use drugs?
Yeah, I can tackle this one too. I'm going to monopolize answering the questions, Devin, here. If anybody else has anything to say on this one, let me know. But it's a really good question, and I think a question that we get oftentimes. I think in a lot of ways, this harm reduction approach when it comes to drug use is not something that people have really learned to be comfortable about. But one of the reasons why we do these trainings, and I think one of the main goals of these trainings is really to normalize harm reduction. We saw on those slides before all the examples of harm reduction that we have in our lives that we use that keep people safe. And I think it's that fact that you're using it in the context of people who are using drugs that is a challenge. But I think if we kind of shift the perspective and think about maybe other drugs or alcohol that people are using in the community and approaches that we've developed, I think drunk driving is a really good analogy where, drunk driving is not something, it's against the law to do that, right? But in our schools, from a very young age, we're teaching people that you don't drink and drive, right? And that's something that's not going to keep you safe. It's not going to keep people in the community safe. And so really that education, that training that folks are providing around drunk driving is an effort to reduce harm, not only for the person who is drinking and driving, but also for community members out there, because we all rely on one another to stay safe. And so I think when we kind of reframe that, you can see the way that stigma and the fact that we may be talking about, street drugs or illicit drugs makes us a little bit more uncomfortable with that idea of harm reduction. But really what we're trying to do is say, your life has value, like your safety has value. Everybody in our community has value, and we want to make sure that you're staying as safe as possible. And we're not going to, and so that's really what the harm reduction approach is about keeping people safe. And I think when we look at it from that perspective, when we try to normalize it like that and see how it's had these dramatically beneficial impacts in our lives in different ways, I think that you can see we're not encouraging, we just want to make sure that we're keeping people safe. That's the goal of this training and really all of the efforts out there that we're doing.
Thanks, Toby. Well said. Well said. I'll share one last bit here before we go, just some more contact information. The website's great. We'd love it if you check it out. If you want to become a sponsor, even better, to support the campaign. The email is great there too. And we've got some pretty cool stickers. We've got some posters, all sorts of great stuff we'd love to share with you. So thanks for hanging with us.
Thank you.
Thanks.
Thank you.